Hi, I am Dr. Vijayraj.Gohil. I am a gastrointestinal surgeon from the India. I am a research fellow in this BMI center, Bariatric and Metabolic Center of Excellence in Ada Hospital. This is a short video clip helpful for the upcoming fellows to solve their questions and questions regarding their training and their fellowship in this Ada hospital. First of all, I will give some introduction about this Ada hospital. This Ada hospital is 2000 bedded multi-speciality hospital situated in Yanchao district in South Taiwan, in the Kaohsiung city. This Ada hospital is of since 2006, it last 8 years, and it has been accredited by Joint Commission of International Healthcare. This Ada hospital, the BMI Center, Bariatric and Metabolic for International Center of Excellence, which is the first international center of excellence in bariatric and metabolic surgery in this Asia Pacific region, which is headed by Dr. C.K. Huang, which is a well-known famous laparoscopic surgeon to this Asia, and even he is a international faculty in globally now also. About bariatric surgical center, it is a center of excellence by itself, because it is everything well structured and well managed by Dr. C.K. Huang. Here about the very high volume center for bariatric patient. Here every bariatric patient which will undergo a through clinical examination by a different like case manager, bariatric counselor, and then health instructor, dietitian, bariatric surgeon, physician, cardiologist, and an anesthetist, a bariatric anesthetist, and of course at last by Dr. C.K. Huang and his team. The research the fellow which will be participated in a new case record, even follow-up case record. They can help in case manager, in bariatric counselor, even they see the new cases and explain about the surgeries to them. And this is a wonderful experience for me, because it's a high volume center here. We have OPD in every alternate day, and the average case record like 15 to 20 new cases in each OPD, and about 50 to 60 follow-up patient, old operated patient, which is very well managed by here. The follow-up is excellent by a bariatric support group activity. I never see before that. Even is lacking in some center of India also. Regarding the operation theater, we have every alternate day operation theaters and high volume surgical center. Every type of surgeries will be performed here, like restrictive surgery started from gastric banding, then sleeve gastrectomies, then another malabsorptive procedures like gastric bypass, the newer procedures like banded gastric plication, duodenojejunal bypass with sleeve gastrectomy. Each and every surgery in a book, in a literature, will be performed here. Even high volume the revision bariatric surgery also performed here. I'm lucky to get trained by Dr. C.K. Huang, which is very good teacher, very good instructor, very good friend, and a very good learner by himself also. He is excellent in his surgical technique, and particularly surgical suturing. Sometimes in operation theater we called him like a robot. He do like a suturing like a robot. So in all, I experienced so well structured fellowship training under him. Initially in the operation theater, the fellows start observing initially first few days or weeks, and then directly go scrub with performing surgeon and with Dr. C.K. Huang, and day by day they learn about the bariatric procedure, and soon they perform the all procedures by himself independently and under supervision by bariatric surgeons. And the operation theater staff is very trained and very helpful, very kind nature and very friendly. I do not find any strangers in operation theater. The bariatric surgical team is a very good team, and very helpful friend, and all they are very good friends to us, to help in each and everything to stay settled down here. Here, regarding the operation theater, another very good research academic activity has been done. We have a journal club, case discussion, case manage and case presentation, research meeting, and then departmental meeting to the bariatric team, and of course the teaching session by Dr. C.K. Huang. The overall experience is very good. I am recently start my bariatric surgery in India. I know about this center, that it is a center of excellence by itself, and it is mainly led by the Dr. C.K. Huang. So I want to come here to improve my all surgical activities. And you never believe that if I came here, I know about each and every detail of bariatric surgery and metabolic surgery, because I know little bit about sleeve gastrectomy and gastric bypass, but now I am confident enough that I can do each and every surgery which will be very well taught by Dr. C.K. Huang. Why this surgical training is important? Because the Dr. Huang initiate his own technique, and he's evaluated his own technique, surgical technique, by his own experience, like a banded gastric plication, and then Roux-en-Y bypass, like it's used cut omega loop technique. It's very simple and very easy, and he teach us very methodical steps and very easy steps of all surgery that any surgeon can follow. And I am confident. I am finishing my this fellowship within 2 days. I am going back to India. I am sure that I can do and I can perform my surgery by independently myself after completing this fellowship. And also I am sure also, if you came to here and do fellowship, and after completing your fellowship you can definitely do a good surgery. So overall my experience is very good. Regarding Taiwan is a very good country to live. All people are very helpful, very kind nature. Regarding our accommodation facility is excellent. And even transportation to the hospital, transportation to downtown easily is very convenient and no problem at all. And lastly, the Dr. C.K. Huang is very good friend, very good teacher, and he learned us each and everything of bariatric and metabolic surgery in a very precise form. And regarding the BMS center, all people are very good friend, and there is no communication barrier here, even language barrier here. Regarding the food, and food in Taiwan is very good. Being an Indian, I do not find any difficulty to live here. So overall my experience is very good. I learned lot of things, and sure improve myself, improve my another my gastrointestinal surgery technique by Dr. C.K. Huang, who teaches us how to do us very good suturing and very good step. And the last and the Dr. C.K. Huang is also a good philosopher. He teaches us how to make a dream and how to fulfill your dream. And at last I tell, the minimal access surgery is inside. The Dr. C.K. Huang taught us this minimal access surgery is inside. So overall my experience is very good. You definitely learn lot of things from here, and you can take so much knowledge of oceans of bariatric surgery with you. Thank you very much.